So, just to sort of set the background a little bit, New York City has become an epicenter for the COVID-19 infection with more than 32,000 cases, right, and 1,200 deaths. Um, I'm Marty Harrison. I'm a nurse in Philadelphia. I'm going to be talking with Sean Petty, a nurse and union activist from Jacobi Medical Center in the Bronx, where nurses staged a really courageous action over the weekend um, to demand the staffing and the supplies that they need to protect themselves and their patients. And so I just wanted to first extend my condolences, Sean. I know that you lost your coworker, Frida Akron, over the weekend. And it's always sad, but also infuriating on the other side, right? This was potentially preventable. So I'm just really sorry.
Yeah, it was, I would say close to 100% preventable. Um, we, um, we actually know that healthcare workers can almost be fully protected from being infected by this virus. I mean, obviously they have the increased risk for being, just generally in areas where there's a high degree of exposure. But there's a pretty shocking statistic that came out of Wuhan, China, where after the initial outbreak and healthcare workers were infected and healthcare workers were
Mm-hmm.
killed
Mm-hmm.
by the virus, the Chinese government basically imported 42,000 new healthcare workers into Wuhan. And they gave them full personal protective equipment. They gave them N95 masks, Tyvek suits, and they trained them very rapidly. And zero out of those 42,000 new workers were infected by coronavirus, even with intensive exposure to,
Yeah,
treating patients. So
sure.
we know that if you prepare and if you do the right thing, that nobody has to get exposed, nobody has to get sick, nobody has to get intubated, and nobody has to die.
Right.
Uh, right now, we're waiting. We have two other coworkers who are intubated at my hospital right now,
Mm-hmm.
and yeah, I'm not sure about those kind of statistics around the city, but I'm sure they're there. I'm
Mm-hmm.
just waiting to hear
Yeah.
about more of our union brothers and sisters who are, going to meet that fate.
Yeah. Well, tell us a little bit more about Jacobi, about the hospital, about the community it serves, about your job there.
Sure. So Jacobi is one of the 11 public hospital facilities in New York City. We have the largest public hospital system in the country,
Mm-hmm.
um, a system that's largely been defended successfully by the unions,
Mm-hmm.
that exist in those institutions, whereas public hospitals around the country have been shuttered, downsized massively. We've been able to keep a fairly robust public system in New York City.
Mm-hmm.
Um, and then my hospital is in the Bronx. We're one of two of the two large public hospitals. The other one is typically more famous, Lincoln Hospital in the South Bronx, and we're in the Northern Bronx. We serve a largely immigrant community, mostly people from Puerto Rico or the Dominican Republic, um, people from Albania, people from Bangladesh,
Mm-hmm.
um, and people from West Africa.
Mm-hmm.
We have, we're a large hospital. We're larger than Lincoln. We're larger than Harlem Hospital. We're a trauma center. I work in the pediatric emergency room. We're the only pediatric trauma center in the entirety of the borough, and even reaching into southern Westchester County, just north of the city. Um, and yeah, we basically take care of the patients that the private sector won't.
Mm-hmm.
Um,
Right.
we we provide the services that the private sector won't. So the way healthcare financing works is that it disincentivizes, you don't make money off of mental health and trauma. So that's what the public system does. We do mental health, we do trauma, and we do all of the rest of it just in an under-resourced way.
Yeah.
And we're a system that's set up to fail financially, right? Because we take care of the uninsured patients, and we take care of Medicaid patients that hospitals don't get reimbursed enough to take care of. So hospitals lose money when they take care of Medicaid patients. And so those are to that block of people as our highest percentage of our patients. And so our hospital is constantly necessitating subsidies from the city and from the state, and we're at the whims of yearly budgets when it comes to how much funding we get and how much resources we get. And yeah, we're understaffed. We've faced pretty severe rounds of budget cuts in the last 7 years. We had just started to recover on the last year and a half prior to this crisis, but we were going into this situation limping for sure. And I've been there for 12 years. I started there, was my first nursing job, and I've been there ever since. And I love it. I love being there. I love my particular specialty. I love pediatric trauma. I mean, I obviously don't love when PD trauma happens to pediatric patients, but I love the care that we give and the expertise and the services that we provide there.
I say often, I love my work. I don't always love my job. Right. My understanding is both Governor Cuomo and Mayor de Blasio are having kind of like daily press conferences about, the latest. How is that match up with your reality in the hospital?
I mean, it's not totally disjointed. I mean, they're most of what they're saying in those press conferences reflects the bulk of the reality. I feel like for the most part, they're being straightforward in terms of like the figures, the deaths, the infection rates. I would say, where there's not enough. I mean, it's less about what they say and it's more about what they don't say. And what they're not saying is, for instance, New York is really no longer testing people for coronavirus. Essentially, as of, about 10 days ago, a week ago last Friday, New York City stopped testing people unless they were going to be admitted to the hospital. So basically all outpatient testing was stopped within the last week. Including most, and healthcare worker testing has been spotty from the beginning. It was always a hodgepodge. And then that decision made it even more, curtailed. So if you have a positive exposure to a patient like I did, you're not necessarily guaranteed to get a test unless you're symptomatic. And even if you are mildly symptomatic, you're not necessarily guaranteed to get a test. And even if you are symptomatic, you aren't automatically tested. You have to request one, you're coached to stay home, and then you're brought back, after 7 days or so. So those are some of the things that aren't being said. And then I think the most profound and frustrating and sort of lie that's being told is that we have enough personal protective equipment, which is what they keep saying over and over again. They talk about potential shortages. They say we're going to be short in a week, we're going to be short in this, but whenever they're asked about, whenever a healthcare worker like myself or anybody else is saying, to the media, oh, we don't have enough PPE, they're like, well, all of our hospitals say they're stocked, and, and have enough. So, they must be, they don't say this, but this is the implication, they must be lying.
Right.
Um,
Right.
and so that's the most frustrating, right?
Yeah.
And, I think, some of it is like, some of it is the fault of just our disjointed healthcare system. Like there's no way for like all these different institutions. You have the public system, you have 5 different major private hospital systems. You have all of these supply chain problems within those systems. But, but there's rationing. There's no question that there's rationing, right? Like
Mm-hmm.
even if you say you have enough, it doesn't mean they're not trying to ration those
Right.
and doing those things in extreme ways. And that's of course going to mean, that you're going to be short in an ICU unit of necessary PPE
Mm-hmm.
at a bunch of given times along the way.
Mm-hmm.
And especially when hospital systems as well as corporations all across the country have implemented all of these just-in-time lean production measures that don't that they want to reduce warehouse space, they want to reduce they want to increase efficiency, so it makes all the supply chains and all of the capacity as brittle as a cracker. So any interruption can cause the system to collapse, and you just see that it's just
Yep.
it's a it's a guessing game which units are going to be the problem today.
Mm-hmm.
With it's not because they solved the problem, but then another one pops up. So
Yeah. Yeah.
it's a constant supply chain problem. And then the bigger problem, and this is something that was the focus of our action, was really at the federal level. And this is around the question of the N95 mask.
Right.
And the fact that nothing has been done to procure an N95 mask in the quantity necessary. And so the fact that the CDC has changed their guidelines about the N95 masks
Mm-hmm.
allows Cuomo and de Blasio and allows the New York City and New York State Department of Health to say we have enough, because they may have enough based on their crappy, unsafe guidelines that the CDC lets them have now.
Right. Right.
So that's the lie and the half truth that we wanted to expose, and we wanted to shout from the hilltops. Our action.
Yeah, it was about 3 weeks ago now, I guess, right, that the CDC relaxed the recommendation and said that an N95 mask is best, but if there aren't any available, then you can wear the surgical mask, which provides less protection, right? And so then it was really written not about science, but about, exactly as you said, supply chains, and then how hard is an employer actually going to work to get you the N95s that you need if they have this, the highest regulatory body in the country says it's okay not to do it.
Absolutely.
Right? Yeah.
And CDC, it was very explicit. I mean, it wasn't explicit in terms of why they did it, but it was very explicit how they did it. Like it was one day, it was COVID-19 is a disease where you need airborne and contact precautions, which necessitate an N95. And the next day, oh, well, COVID-19 is now an organism that only requires droplet precautions, where you can use a surgical mask. And zero explanation about, did the virus change? Nope. Did the science change? Did the studies change? Did they find out new information? Nope. Well, then what did you? Oh, the American Hospital Association lobbied you because they don't have any N95 masks. Oh, that's what changed. Okay. So yeah, no, it was very clear. And then overnight, all of the departments of health and all of the hospitals changed their policies immediately. And we, of course, noticed a big change in our protection.
Right. Right. And that it became a big issue at Mount Sinai West too, right, with the gowns, where those nurses that didn't have the proper impervious gowns, the waterproof gowns, were putting trash bags over paper gowns. And then that image got on the front page of the paper. And then their administration essentially said they were lying, that they had enough. But that's it's just not true.
Right.
right? So nurses were kind of like crying from the rooftops, we don't have what we need. And everyone was like gaslighting us, saying, yes, you do, yes, you do, yes, you do. When if you read the box of N95s, it says single use only. And right, nurses are being given one mask per day or one mask per week, which is just not right. So
Totally.
how, yeah, so how
Nurses
did
know
you,
that. So I mean, these are things where your supervisor would like
right,
discipline you or
exactly,
fireable offenses,
have your
two,
head,
2 weeks ago.
yeah,
And so people are like, really? So you're making me do something that I could have gotten fired for 2 weeks ago?
right,
And
exactly,
and people know that's not science. People
right.
know that that's that, and then they also know exactly what this system is capable of in terms of exposing them.
Yeah.
So yeah, and
And the inverse was true too, right? That if nurses were trying to protect themselves and wearing the equipment, they were sometimes being harassed or threatened
totally.
if it wasn't according to the new
Yeah, and that
indication.
was even so. Like when we after our action, or actually right before our action, we had gotten when they found out the New York Post actually ran a story prior to our
Yeah.
action that we were going to do it, and the city got our union on the phone, and they were like, well, you know, what's the issue here, and like, you
Mm-hmm.
know, and that was what they kind of said was like, there is no like they were basically like, well, we're not trying to be strict about this. People can, if they want a new mask, we'll be able to give them a mask. And it's like, well, but wait a minute, if you put out a policy to, you know 9,000 nurses, to all of these supervisors, that says one mask for every 7 days, you don't think there's going to be, all kinds of tyrannical managers who are going to be
Mm-hmm.
policing nurses?
Mm-hmm.
You know what I mean? It's like, because the idea was like, well, if somebody wants one, they could just get a new one. We're not being harsh about that. And it's like,
Yeah. It's just
yeah,
not
no,
true.
that's not how it works on the ground. Like,
Yeah,
and you know
exactly.
that. So,
Yeah.
that. So I think we actually, that discussion actually, we actually probably might get a policy change that says something to that effect.
Mm.
That if people actually need a replacement mask, for whatever reason, and there's going to be no retaliation, and like something,
Mm-hmm.
something along those lines, where
Right.
they're not going to change the airborne contact, you know,
Uh-huh.
um, they're not going to change that guideline, but they're saying they're going to signal to their staff not to essentially police,
Mm-hmm.
um, replacing
The
your
use of it.
N95 when you need
Yeah,
one. So we'll see. Of course, I only believe things when I see them, but
yeah. Yeah.
that's what they're saying.
Well, tell us more about what you were seeing at Jacobi with the PPE and staffing, and how patients were presenting, or how the numbers surged, and what led up to people actually, nurses feeling like they had to take action.
Well, I think the two things. I mean, we're just starting to see our surge at Jacoby.
Mm-hmm.
We're I think over the weekend was when we sort of officially filled up.
Mm-hmm.
Um, and we were starting to get back up in the ED. And I think on Sunday when I was there, we had like 25 held patients in the ED. Many of them COVID, many of them not being able to be in isolation rooms, exposing, not even in private rooms, not even in curtained rooms, like in stretchers in the hallways. So, you know, uh, they were scrambling. They were putting patients on the pediatric floor, which, I'm in pediatrics, so we've been lucky that our of course our census has actually dropped during this crisis because of all the social distancing measures, and that's had a actually fairly significant impact in terms of, you know decreasing pediatric emergency room needs. Um, but so they were cramming, and we're in the middle where they're just now talking about measures to turn 2-bedded rooms into 3-bedded rooms, turning 1-bedded isolation rooms into 2-bedded isolation rooms, opening up, units that they had closed a million years ago, and, you know turned into office space, and turning those back into hospital rooms, et cetera, et cetera. So they're kind of doing that in a rolling kind of like day by day kind of a way, and kind of winging it. So we're just I wouldn't say we're keeping our head above water, but we're keeping our head probably at least only 6 inches underwater, for now. Um, but but yeah, I think the bubbling up that led to the action. I mean, yeah, people had started to. I mean, our ICUs definitely were first hit. The
Mm,
ERs and the ICUs, and the main impetus for the action really came out of the emergency room and all the just kind of
right.
chaos and exposure that was likely to happen. And definitely earlier, you mentioned the harassment. Like one of the deputy sort of chief doctor had yelled at a bunch of staff for suiting up with N95s going into a trauma.
Hmm.
Uh, and mind you, that is one of the actual specific instances where you need an N95 mask because
Right.
there can always be a potential intubation. And
Right.
intubation, even according to the crappy new CDC guidelines, is definitely one of the places that you need airborne
Exactly.
protection.
Hmm.
Um, and so, but it was just that atmosphere, that level of just, we need to preserve these. I actually got into a huge fight with my head nurse because I was trying to implement our 1 a day policy for our nurses. So I took our box of N95 masks when I came in the morning. I put one in a plastic bag for each of our nurses so that if they had to go to a trauma, they would
Hmm.
have them on hand. And basically I got into a 45-minute, shouting match with my head nurse who was pissed that I did that I took matters into my own hands to
Mm.
prepare my staff, and that we're in such short supply of these and blah, 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 blah. And I'm like, yes, I know. That's why I'm doling them out and not letting them, be rifled through, for whatever reason. I'm giving them to people so that they can have them when they need them. But
Hmm.
anyway, so it was that kind of atmosphere that led to this the impetus for this action. And then I think last week on Wednesday there were two things that happened. One was the death of the nurse at Mount Sinai,
Right.
the first nurse, and so that kind of sunk in for people in terms of how real this was. He was a younger nurse, I mean, it was youngish, you know. It wasn't like he was 80 years old and with a billion underlying conditions or whatever. So I think that really um, got a lot of people's attention and stoked a lot of fear, understandably. And then the same day, our institution announced that for outside of the emergency department, all staff would have to go with one N95 for the entire week, um, and reuse the mask throughout the week. So that change in policy and the death of that nurse combined, I think, compelled a bunch of people to say, we have to do something. We know we have to socially distance. We know we're all like on this lockdown kind of situation, but we have to do something. We have to get people's attention somehow.
Hmm. And what kind of like organizing steps did you take before you actually went outside to get people like on the same page and to like build that momentum?
Well, we have been circulating some of the data, and some of the policy changes, and we have been talking about this whole N95 situation for, about a week and a half. We've been, you know, um, because we were so, myself and my close collaborator Kelly Cabrera, had been really, you know, had our eyes on this issue, like coming out of the CDC, and our union had been doing had some good materials for that. Um, and so we had been talking with nurses about why this was necessary because it was a debate. Among healthcare providers, and certainly our management was towing a certain line, but other people didn't. They didn't necessarily know that you know the surgical mask was you were being compromised with a surgical mask. Or why it was important to necessarily have the N95 mask. So we had already had started to do some of that education and had some of those discussions so that when those changes happened, that those were interpreted as they should have been, which is that how much they were putting our lives in danger by making these policy changes, and that they could associate not having the N95 with the fact that somebody died, not having that right PPE with the fact that somebody died. So so we had done some of that educational work, and that was important. And then we actually sort of took over what our hospital had just implemented, which was these shared governance meetings. These co-labor management meetings that are supposed to set policy, and they're supposed to be these democratic spaces where nurses get a voice and all this stuff. And of course we know,
Magnet.
yeah, magnet stuff and all that. And we, of course, we know that those are, those only go so as far as you can control the checkbook, right? Like, you can't make a suggestion in there that costs money that's going to get implemented. And so, but we used it as an opportunity where it's like, okay, let's talk about the PPE situation. Let's talk about N95s, and let's talk about what it would take. And so we talked about it as, yeah, this hospital policy is crap, but it's crap because the CDC policy. It's crap because this entire country doesn't have enough N95s. So we actually have to do something that not only, gets the attention of our own hospital administrators and our city and our state, but we actually have to, we have to do something that might, that might try to get a response from the CDC, that might try to get a response, nationally. So I think that led us to discussion of tactics that needed to be outside of the walls of the hospital. This wasn't something that we could do indoors. This wasn't an office that we could go market to. That we needed to actually go public. We needed to go to the media. We needed to get a different message out there. We needed to get a different narrative out there. So we wanted to have an event that would get the attention of the press and of the community. And we knew that it would be risky. We knew that would ruffle some feathers. We knew that we would be potentially, they would attempt to say that we're breaking the law or breaking the emergency order by conducting a gathering, which is the vague description in the emergency order. You can't have a gathering. But so we had our backup plans. Like, the rule is you can't have more than a group of 10, and everybody has to be 6 feet apart. So it's like, okay, yeah, if we have 40 people, we'll have 4 groups of 10, and let's see what they say or what have you. And so, yeah, so that was the way the discussion went. And I think it became really apparent that, yeah, we have to get this, and that, it doesn't have to be the entire hospital. It can be, a few dozen of us. It could be 30, 40, 50 of us. And, that can send a strong message, and that can be a good start. And so people were like, fine. This was like Thursday morning, and people were like, let's do it Saturday morning. And me and Kelly were like, okay, if you guys want to. I mean, usually it takes a little bit longer than that, but people seem rearing to go, so let's go for it. And so, yeah, so we did. We just started scrambling and got everything together, and I drove my car down to the Union Hall and picked up the signs and all that stuff, and we put it together, and yeah, it turned out to be right place, right time, and we really got the eyes of a lot of people on us that day.
Yeah, a lot of attention. And what were the concrete demands that you were putting forward to administration?
Well, it was basically under two. You could say it's under two categories. One was the very specific and very clear demands that we wanted to get out there was one squarely on the federal government. We said, this is a national problem. It needs a national solution. The Trump administration needs to invoke the Defense Production Act and start production of N95 masks immediately. And that's what is causing this problem, and it won't stop until that problem is fixed. And so the idea that that we're safe without these masks, that we have enough of these masks, is a total lie, and we need that to happen now. It should have happened 2 months ago. It should have happened 1 month ago, but it hasn't, and it needs to happen today, and it will need to happen tomorrow. So that was sort of our frontline message, and then we sort of had an implicit secondary message, which was, So therefore, if you hear any, elected official or health official or hospital administrator saying that we have enough PPE, that's a lie too.
Mhm.
Um, and that they need to change their policies to go beyond what the CDC is recommending,
Mhm.
um, because they're unsafe. And we know we know why they're unsafe. We know why they changed their policies, but that doesn't change the fact that doesn't change their safety.
Mhm.
That just that we need them to be honest about it. They're going to put us in danger. We need to know why. We don't want people covering for their own reputations. We don't want people covering for other people's reputations, and apologizing for the danger that they're putting us in. So,
And how did administration respond?
um, well, so we got so the city and H&H, they sort of hurried and got our union leaders on the phone the night before, and sort of had that conversation, like, okay, what do you need? What do you actually saying? What are these nurses demanding? And so we had gotten that response, and they basically agreed to be hands off. So we didn't have any interference from hospital administration. They didn't show their faces at all. I kind of expected, because this was a bit of a, this was not a, like, we've never had an action on, we have a very large campus, and it's one of those hospital campuses where you drive onto the property, and you drive down a long driveway, and you drive up a hill, and all of that is hospital property. And most of the time when we have a rally, we have it like outside on the street,
Mhm.
but we had our press conference on the hill on hospital property in front of the emergency room.
Wow.
So this was that was a very new thing, and so we were expecting some resistance. We were expecting a little, you know, static from hospital police, maybe even NYPD, about the social distancing thing. We were expecting administration to freak out a little bit, but clearly they were told to be hands off,
Yeah,
and
yeah, sure.
and um, and so that that was great. They I mean, at the beginning we was joking with Kelly about, you know, yeah, I would love to have the conversation about whether we should stay or go. We can have it in front of all five of these reporters that are parked right outside of the, you know, yeah, let's make that a collective conversation about where we can have this conference.
Exactly. Yeah.
Uh,
How,
and
how did the nurses respond, either at Jacobi or other facilities? Have you heard from any like non-union nurses who are like, "You guys are the best. We need
right.
to do this too. Come help us."
Well, in New York, we don't have too many non-union nurses.
Oh,
um,
good. Glad to
Uh,
hear it.
I mean, there are some at NYU is a big non-union place, and some out on Long
Mhm.
Island and stuff like that. But most of the nurses are union in New York City proper. But because of the hesitancy of everybody with the social distancing and how hectic everything is, I think we did break the ice quite a bit. We were hearing immediately from a, whereas prior to this, discussions that I would have with other people at other hospitals, like, oh, I don't know if people would go for it. People are so overwhelmed. That seems,
Mhm.
what about the social distancing thing? Like, people were really hesitant. But after
Mhm.
they saw us, it did sort of break open the floodgates a little bit. I was like, that was amazing. We should totally do that now. And like, it actually, we're gonna have actions at other hospitals this week because we sort of broke the ice on that. And
Mhm.
so that was really great. And yeah, I mean, and nurses were super sick. I mean, the number of the nurses that participated were brand new. They had just started in May of last year. They had just started,
Wow.
this year,
Mhm.
in the emergency room in particular. And they spoke to the press. They were super, upset about what was going on.
Mhm.
And I think, that just speaks to something that we have been really trying to do as a union leadership at the hospitals. We knew, pretty much over the last 10 years or so that, there's a there's a youth radicalization in this country, right? Like, there's people that have been inspired by the Bernie Sanders campaign, inspired by resisting Trump, inspired by, you know, having to deal with life after the 2008 financial crisis, and that um, there's just less cynicism among younger nurses. People aren't as beaten down. People see more possibilities. People have higher expectations. When you're new to a system, you don't accept the same realities as somebody who's been dealing with it for 10 or 15 years, and so you're like, this is fucked up and we should change it. And you're like, yep, exactly. let's go do it. So we had that happen at our action, and we had some really great testimony from some of those nurses, and some of the experienced nurses, and a lot of people. After me and Kelly spoke to the press, so I think we had like 7 or 8 different nurses come up and speak to the press, and it was very open-ended. Definitely not like a normal union press conference that I go to, where it's like you're handed your script, and the message has to get pre-approved and all of that. And so no, it was basically a speak out in front of 10 cameras, and the Associated Press, the AP reporter. So it was good, and nurses were really psyched to see us, of course, all over the media the next day, or later on that day.
Yeah. It's like, as a socialist, I see that like part of our we get our power as workers from the work that we do, and the fact that the boss needs us to do the work. And this has gotten to be really, really clear in not only in healthcare, but in a lot of other workplaces where people are considered essential now, grocery workers, logistics workers, etc. Like, how are nurses thinking about that at Jacobi now? Like how much power they have because the boss needs them so badly right now.
Totally. I mean, I think that was part of the equation from the get-go. I mean, people knew that. I mean, I think, and that's part of how we talked about it, was basically like, look, right now, it seems like, at least it appears like, that the people in power can do anything that they want, because everybody has to stay home in their isolated places. But we were like, look, we are some of the few people that actually are required to come to work and required to come together in a collective space. And we're obviously providing and risking our lives to provide one of the most essential services right now. And I think people really understood that, really early on. I think that the problem for us, of course, in nursing, as you very well know, Marty, is the challenges of doing workplace actions and striking as healthcare workers, and the challenges that come up in that context. And of course, those are even more exacerbated by being in a pandemic, like the idea of withholding your labor or proving your economic power or your leverage, when you're needed the most, is very challenging. So I think it was, the fact that people sort of did it in a little bit of a safer way, but got the same message across, I think was a really good first step. I mean, we've talked about doing other things like, because there's emergency powers, they're not going to prosecute people around documentation errors. So, if using our leverage in terms of like, and of course, documentation is how hospitals get paid. There's ways in which you could do organizing that, is around those kinds of tactics and sort of works to rule type stuff. But yeah, I think the fact that it was so public, people could see each other doing it, people could see each other out there. Nobody was afraid to, people, I mean, some people were afraid to come out, but they saw that other people weren't. And so, and in the middle of this just kind of crushing atmosphere where you're afraid to go outside, right? I mean, that's what's happening right now. People are afraid to go outside.
So I guess as we're wrapping up now, I mean, that was really inspirational to me, your action. I hope that people take it from there and like build on it and escalate and find ways to be more public and more powerful, so that we as nurses are the ones, and other healthcare workers together, are controlling like how we do our work, how our work how we get the supplies that we need, our supply chains, all those sorts of things that just don't work. Like you said, even though you're in a public system, it's still subject to, you can't be an island in a capitalist world and not be affected by it, right? You're still subject to all those budget cuts and the Trump CDC and Cuomo's cuts to Medicaid, and all those things just are adding up into like just adding to the crisis, which would have been a crisis in any case. But do you have any like great words of wisdom to send us out on here about how socialists and healthcare workers and other essential workers can be fighting to change our workplaces, to change healthcare, to change our unions, to get a world that's based on what humans need and not what the corporate elite.
Well, I think we grow up and we live always in contradictory times, but these times are so profoundly polarized and contradictory in terms of just what they're revealing about the gap between what this system pretends that it can provide us and what it actually can provide and what it actually does provide in terms of healthcare, like we spend in terms of all services. And it's just showing that every day. Like the fact that Trump is even allowed to, take a stab at the idea of opening up the economy by Easter, and that would even be a thought at the risk of hundreds of millions of lives, just in order to continue economic growth and continue reestablishing profit margins. And that, most people are conscious of that. Most people know, like, why would that even be a thought that crossed anybody's mind? You know what I mean? And I think that those things are being exposed. I was reading an article by Kanga Yamada Taylor, and she said, when the world gets turned upside down, the bottom gets exposed to the sunlight. And that's totally what's happening right now. And I think that, we're seeing the worst of our people, the people in power right now, and we're seeing some of the potential for some of the best of working people to run, to come together through this crisis, and not only do the things like do the work itself, do the healthcare, do the deliveries, keep the supply chain going for people to be fed. But we're also, I think just seeing a real political awakening of what this system really actually is about and what are its priorities. And I think that's going to mean, we're going to have some really challenging times. We're going to go when the crisis peaks and when we start to recover, we're going to recover to the insanity of having gone through the worst healthcare crisis ever, and them trying to cut hospitals, them trying to cut schools, them trying to cut these social services, and that we already knew we needed 5 times as many as we did, going into this crisis. So that the fact of those things, and how stark they're going to present to people, is going to open up so many opportunities. The fact that people are already out of work and the health stakes of going back to work are going to be high. And the situation that creates for the potential for people to say, no, I'm not going to do that. Let's organize, let's organize rent strikes. Let's organize us not having to go back to work. Let's continue to put pressure on our political system. That's a political situation that we haven't seen really in our lifetimes. And I think it just opens up tremendous possibilities for the idea that people should come before profits under all circumstances, and that we need to make that a reality, in the day to day, and that we have the potential collective power to make that a reality in the day to day, and direct action gets the goods. So,
that's right. When we fight, we win, huh?
That's right.
Exactly. Thanks so much for your time, Sean.
No problem. Thanks, guys.